I really think Georgetown is the place to be. We're able to provide the most advanced care that anyone could provide in the world in a loving and caring environment, and we're really doing some special things. We have just really incredibly talented people who are so passionate about what they do. You know, from the most mundane cold to the sickest of the sick, whether it's a complex cancer or intestinal transplants. We're fortunately able to take care of the most severe illness that a child could ever face. And we have multiple specialists all coming together, all able to look at different aspects of a child's problems.
We jointly treat patients with both neurologic and genetic disorders. So neurogenetics clinics are rare. There are very few multidisciplinary clinics of this type. We pull together all of the resources within MedStar to bring the most advanced diagnostic tests to our patients.
It's been very exciting. There's been a lot of progress in terms of genetic testing, so now what we can offer the patient is so much more than we could even just 5 years ago.
So both of our daughters came at different times to the neurogenetic clinic. We didn't have to go to multiple different doctors' offices, which made our lives as stressed out parents so much easier to only have to be at one place at one time and get the full amount of care needed. Was truly a wonderful experience.
They collaborate with so many doctors on both coasts internationally. Again, very comforting as a patient to know that you have so many people on your side looking for answers and trying to get to the bottom of the condition.
The Aerodigestive Clinic is a multidisciplinary clinic comprised of several specialties getting together to help kids with multiple medical issues. We are willing to see patients who are complicated, and there's nothing like that in this area.
I was really desperate. Nobody was able to tell me exactly what's going on with my son, why he's not eating, and he wasn't sleep at night.
Daniel Seth's family was able to be seen by a number of our pediatric specialists and our nutrition, our nurse practitioner, and myself so that they could get a cohesive, holistic plan. He had GI issues, he had an undetected dairy intolerance, he had pulmonary issues. He also had several developmental delays that warranted more intervention just from the medical standpoint.
And everything she said to me that day makes sense. And I just started crying.
We worked to get him speech therapy services and occupational therapy services at the hospital.
Changed his diet completely. He's eating much more adventurous. He's eating fruits first time in his life, which mother was not able to give him before. And then 6 months later, he's certainly a very different, happy baby.
This is our new Care Mobile unit. It is awesome. It's got 20% more space. We're very excited about it. This Care Mobile is so important to bring services to where people live and to remove the barriers to care that they might face. And we really focus on the family, and not just in medical care, but in the 5 pillars of health: physical health, mental health, oral health, nutritional health, and the social determinants of health, and fusing them together. And if this Care Mobile was not here, many of our children and their families would seek care in a fragmented, disorganized system.
That's what makes this a special place. At the end of the day, it's a child's smile that makes this what it is. It's the best job in the world.